Good afternoon. Thank you for joining us for today's webinar. My name is Nastasia Walsh. I'm a program manager at the National Association of Counties. I'm going to be moderating today's webinar. This webinar is part of Stepping Up, which is a national initiative to reduce the number of people with mental illnesses in jails. It's a result of a partnership between the National Association of Counties, the Council of State Governments Justice Center, and the American Psychiatric Association Foundation. We received generous support from the U.S. Department of Justice's Bureau of Justice Assistance for this project. Before we begin, I'll go over a few technical details just to make sure that everyone can watch the webinar correctly. This webinar is being recorded. It'll be posted on the Stepping Up website for future viewing. You will receive an email in the next few days with the link to the webinar recording and the PowerPoint slides. Also, immediately after the webinar ends today, you'll receive a notice asking you to complete a webinar evaluation survey. We would really appreciate folks filling out those surveys. We do look at them, and your feedback really helps inform what we do in the future. So some tips for viewing this webinar. First, to the right of your screen, you'll notice there's a control panel, and in this panel there's a questions box. You can use this box to type in questions or at any time to send us a message if you're experiencing any sort of technical difficulties. If you're having any technical problems, we will respond to you privately to help resolve the issue, and then during the Q&A session, I'll read any of the more content-related questions on your behalf. If you want to have a better view of the presentation, you can click the small red arrow in the top left corner. Before we begin, why don't we do a couple of quick audience polling questions? Can we go ahead and launch the first poll, please? Great, thank you everyone. Let's go ahead and close that poll and we'll launch poll number 2. Okay, it looks like just about everyone has responded. Why don't we show the results on this one, please? Great, so it looks like pretty similar to some of the other Stepping Up webinars that we've done where we've got about 19% are county officials, about a third of you are from some sort of health or human services agency, about 10% for law enforcement, and then a few state policymakers and some others on there. So thank you everyone for participating in the polls. So before we start with the content of the webinar, I want to give some quick background information on Stepping Up. Like I said, Stepping Up is a national initiative to reduce the number of people with mental illnesses. The purpose is really to bring together local and state leaders, professionals from criminal justice, mental health, substance abuse, really to sort of steer and support some systemic and long-term efforts to reduce the number of people with mental illnesses in jails. We know that 2 million adults with serious mental illnesses like schizophrenia, bipolar disorder, major depression are admitted to jails across the country every year. Many of these folks also have co-occurring substance use disorders as well. Many people with mental illnesses are arrested for relatively minor crimes such as loitering and causing a public disturbance, which tend to stem from their illness or addiction rather than their intent to do harm. And then once incarcerated, people with mental illnesses tend to stay longer in jail and are at higher risk of reincarceration than their peers without these disorders. So really for all of these reasons and more, Stepping Up was started as a means to really elevate this issue to the national level. The 3 project partners, so the National Association of Counties, the CSG Justice Center, and the American Psychiatric Association Foundation are partnering with a variety of organizations such as those listed here on this slide, really to maximize some of the existing resources that are out there already to assist counties. These folks are those on the steering committee of the Stepping Up initiative. The Stepping Up project was launched with the intent of having counties sign on to a call to action by passing a resolution to support the initiative and to commit to developing an actionable plan that makes more efficient use of budgets, promotes access to treatment and support services, and encourages research-based practices on this important issue. And I think this really goes to what the presentation is about today on preparing a plan and tracking your progress. On the Stepping Up website, you can access a sample resolution that can be modified to your county's unique situation and your needs. In that resolution, we're asking counties to pledge to reduce the number of people with mental illnesses in their jails, to commit to sharing lessons learned with other counties in their state and across the regions and across the county, to make this a real national initiative, and to encourage all of your local county officials, employees, and residents to participate in Stepping Up. As of today, right now, 149 counties across the country have already started to sign on to the initiative by passing a resolution or proclamation. I want to do a quick polling question about this right now. If we could launch poll number 3, please. Okay, I think that's just about everybody. Why don't we show the results for this poll? All right, so we've got 38% of you who know that you've passed a county resolution, about a quarter of you who have not, and then the rest of you are not sure yet, and that might be because you're working in a different system or you haven't been connected to the county elected officials in that way. So good opportunity for some communication about the initiative. Thank you, everyone, for participating in this poll. So I want to talk a little bit about technical assistance. For those who are interested in starting initiatives on the ground, and those of you who have been doing this for a long time, which I know a lot of you have, the Stepping Up partners have developed a series of technical assistance resources that are available to help you create or implement or enhance successful strategies to move forward with your own initiative. The resources are broken up into 5 different modules, each of which includes a webinar like this one, research, self-assessment tools, county examples of what other counties are doing, planning exercises, and a planning guide to help you really catalog what your resources are and your strategies and what you need to move forward. And the module planning guides for this webinar will be posted within the next week or 2. The intention is really that you use these tools to encourage and then support the conversations that you're having at the local level. We know that counties will be starting at all different stages in this planning process. Some of you have already made significant strides towards addressing this issue. Others are really at the beginning process, and you'll hear from a couple of different counties today who are at different spectrums as well in this process. We want you to be able to use these resources to really tailor them to what makes the most sense for you and what works best for your county. These are a list of all the Stepping Up webinars that we've hosted so far. All of these webinars, including the one that we're doing right now, are archived, so you can watch them, share them with your teams later. If you want to review them again, they're all on the Stepping Up Toolkit website, stepuptogether.org/toolkit. We also encourage you to sign on to the Stepping Up mailing list by clicking on the Take Action Now button and putting in your email address, and that way you'll make sure that you receive all of the upcoming webinars and new resources that are coming on. You'll be on that email list. We are also, I just want to keep encouraging counties to share with us what you're doing. Some of the challenges and barriers and successes that you're facing. We really want to highlight these success stories on the Stepping Up website and on future webinars. And please feel free to email us if you have anything that you want to share regarding that. So let's jump into today's webinar. As the last of the Stepping Up webinars that is exclusively focused on the 6 steps, not the last Stepping Up webinar, just the one focused on these 6 steps. There will definitely be more webinars. This webinar will bring together the knowledge you've already gained from the previous 5 webinars to really help you to develop a plan for moving forward in your county. We'll hear from Risa Hanneberg from the Council of State Governments Justice Center, as well as Sarah Peterson from Paddington County, South Dakota, and Leon Evans from Bexar County, Texas. So without further ado, we'll now hear from Risa Hanneberg. Ms. Hanneberg is a Senior Policy Advisor for the Council of State Governments Justice Center's County Program. In this position, she provides technical assistance to county systems improvement projects, the Stepping Up Initiative, and Justice and Mental Health Collaboration Program grantee sites. Before joining the CSG Justice Center, Risa served as the Criminal Justice Coordinator for Johnson County, Kansas from 2008 to 2014. In that role, she provided staff support for the Johnson County Criminal Justice Advisory Council, and she also facilitated the coordination of criminal justice-related activities from the district court, the sheriff's and district attorney's offices, Department of Corrections, court services, and the Johnson County Mental Health Center. Her work in Johnson County involved both juvenile and adult divisions, and some of her major projects included the Justice Mental Health Collaboration Intercept Project, Second Chance Act Reentry Project, Juvenile Detention Alternatives Initiatives, and Justice Reinvestment at the local level. I'm going to turn it over to Risa now. Please take over.
Okay. Hello, everybody, and you can have the next slide. So today our topic, as Nastasia said, is developing a plan using research-based approaches and measuring progress. Next slide. So just a very quick review. As Nastasia said, this is the last scheduled webinar for the Stepping Up process, and today we are going to focus on steps 4, 5, and 6. And I just want to start off by congratulating all of you who have hopefully diligently been participating in the webinars, and hopefully you have also followed through with completing the planning exercises, and that this has been helpful for you as you've been convening your local collaboratives and addressing this important issue. Next. So I'm going to start with addressing, why system planning. And so for me, I just want to first of all draw upon my experience. As Nastasia stated, my background is with Johnson County, Kansas, and I spent the last 5 years there serving as criminal justice coordinator. So basically my job at that point was, every day I was working and planning for system-wide approaches to improve our justice system. And we did take on the work of reducing the number of the mentally ill in our jail dating back to 2008, 2009. And we started down the road and very soon got involved in a very sophisticated planning process. And I just want to say that today in reflecting, I think that if we had not spent all that time and attention to the planning, to looking at the data and analysis of the data, and looking at what other kinds of things jurisdictions were doing and best practices and so forth, I think if we had not gone through all that work, we would have probably just assumed that the next thing we should do would have been to create a mental health court. And I'm not saying anything here about pros or cons of mental health courts. I'm just saying that after we spent that great deal of time on that thoughtful planning, we then decided to focus our first steps at the first intercept, and that of law enforcement special responses. And as a result, we piloted a co-responder, and it proved to be a very, very successful program for Johnson County, and certainly demonstrated some results that would point to the reduction of those coming into our jail and our justice system with mental illness. And so I think that's what we want to mainly talk about today, is how to use your planning and how then to keep your eye on the ball, begin with the end in mind, whatever your favorite motto is that will get you towards a system response that will reduce the prevalence of those with mental illness in your jails. Next. So after I just spent all that time talking about system-wide planning and keeping your eye on the big picture, I'm now going to say it's also very important to sweat the small stuff. Seems kind of counter to the other slide, but I do want to point out how very important it is that a lot of this work is very detail-oriented. There's a lot of nuts and bolts to having a collaborative planning session, maybe agreeing on some process or policies or what have you, and then who is going back to their desk and doing the nuts and bolts of making this stuff happen. It's hard work, and it generally takes somebody being a designated coordinator to keeping their eyes on the fact that where you want to go is progressing, keeping the work moving, and those kinds of things. Understanding who does what, when, and how, I think has to be designed to benefit not only the individual but with mental illness, but the entire justice system. It's very important that you've done some of that early groundwork of developing your consensus around the fact that it's going to be necessary to move past turf issues, that it's going to be necessary to move past traditional forms of criminal justice, and be willing to look at new kinds of alternatives that will better address the needs of this population. Next. Okay, so again, the overarching goal of stepping up is to reduce the number of people with mental illness in your jail. And the typical planning and the status quo, if you will, is to look at strategies typically around these key decision points in your justice system, be it law enforcement, your initial detention period, jails and courts, reentry, community corrections. I think we're used to this type of planning and the work that it can lead you to. Next slide. So here you have a picture of what is probably very familiar to many of you, and that is the sequential intercept model. This is certainly a planning tool that we used in Johnson County that got us going on our work and looking at each of these intercept points, gathering data, if not actual data, our one-day in time counts or best guesses, if you will, as far as prevalence in each of those intercept points, and then doing some very detailed system mapping at each of these intercept points and where the key opportunities are for improvements in the system. And I'm assuming that these are the kinds of projects and discussions that you are having now in your local jurisdictions if you haven't already. Next slide. At the Justice Center, we've been having a lot of discussion as we follow not only the work of the Stepping Up sites and working with the partners and developing the webinars and also those planning exercises, but also some of the other work that the Justice Center has done recently in specific county sites that has led us to have discussions around what do you do beyond this gaps analysis? How do you move towards planning a system response that addresses reducing the prevalence of mental illness in your jail? And how do you do this with a plan where you know up front what you need to measure and that you're implementing strategies that measure for those key indicators? How do you make sure that your planning ensures that you're following evidence-based practices and that you're going for the strategy that gives your jurisdiction the most bang for the buck, if you will? And when I say that, I'm talking about serving the most at-risk populations. How do you get at devising your implementation of programming and screening and following up and connecting with that population that presents not only as having some type of behavioral health illness, substance abuse disorder, or also appearing and risking out on criminogenic risk as moderate to high, that this is the kind of population where you know you need to definitely be strategizing and coming up with alternatives. Next slide. So again, looking at those strategies that generally will, if you will, focus around law enforcement diversion, screening and identification, connection to services and community supervision, and then lining that up with what at the Justice Center we have developed as 4 key outcomes or 4 key measures that will get you to that overall end goal of reducing your prevalence. So let me just go over these outcomes with you. The first is reduce the number of people booked into jail with behavioral health disorders. Then reduce the length of time people with mental illnesses stay in jail. Increase connections to community-based services and supports, and reduce the number of people returning to jail. So following your strategies to line up with these outcomes should get you to where you want to be, that end game of reducing your overall prevalence rates. Next slide. So what is this going to require? Well, at a minimum, the first step is screening. It's absolutely imperative for you at your local level to begin to get a handle on what your prevalence rates are. And the only way you can get to this is to establish screening at that early intercept point of booking into the jail. So having validated screening tools in place to screen for those with mental illness and substance abuse disorders is essential. And then once you have achieved that, there needs to be some sort of process of flagging, whatever term you want to call it. How are you going to communicate who those individuals are that have been identified as needing special services and supervision to address their behavioral health needs? And this needs to be information that can follow them from the point of booking throughout the system, so that the rest of the system-related decisions can be informed by this information to make better decisions, to make better case management kinds of decisions and court-related decisions. From there, the next step is connecting, ensuring that connections have been made, be it to more formalized court-based supervision or community-based kinds of services. And not only connecting, it's more than just handing them a card with some phone numbers when they walk out of the jail door. It's that warm handoff, it's that verification and that follow-up that the connection occurred and that they're sticking with it. And then, of course, the ability to track your data and to measure your progress. And this is obviously important. You want to know that you are achieving some success, but it's also very informative for you to use as you keep your decision makers and your funders up to date on your progress and address sustaining programs. Next slide. Okay, so please note the under construction sign on this slide. I feel like it's important to make it clear that using these, rolling out these 4 key measures to use to track your progress is very much under construction. The Justice Center, we're learning from you as you all are making headway in progress. We're keeping up on latest research. We are having ongoing discussions around how to work with counties and provide that technical assistance that is needed for you to be able to reach the abilities to track for these measures and to report your success and your progress. So in order to make each of these 4 measures able to be tracked, you're going to have your data, you're going to have policy and processes that you implement, and you're going to have developed system capacity, primarily around your IT resources to be able to demonstrate your progress. Next slide. Okay, so for the next 4 slides, I'm going to take each of these 4 key measures and unpack them for you just a little. What is created for you is a chart, if you will, that takes each of the key measures, and then under each of the columns, you see data to track, policy and process to implement, and system capacity to develop. Again, I want to stress this is a starting point for you and for your collaboratives, for your discussion and guiding your process as you move towards making your prioritizations and decisions around what to do next in your communities. If you look at the first 5, you can start to take some sort of an inventory. Do you have this data? Can you get to this data? Will you at some point be able to? It's the first one, for example, not necessarily an easy one to get to. The number of people identified as having mental illness diverted from jail by law enforcement. So this is what's happening out there on the streets before they step foot into your jail, and many times before there might be some organized way of capturing this data, particularly if you're from a jurisdiction with multiple law enforcement agencies. It is important. It's probably, if not one of the most significant points in the process where you can clearly have some very large impact. Certainly I know from our co-responder project in Johnson County, our co-responder was working with anywhere from 700 to 800 folks in a calendar year, and then being able to ascertain from that how many would have potentially been booked into jail had co-responder not been there, how many were diverted, be it to community-based programming, or if they went through hospitalization or some other crises kind of responses. The data following that you're asked to track or to consider tracking obviously means they did step foot into jail, but I think it's important to get this up front as far as tracking those who are then screened positive for potential mental illness, for potential substance use disorders, and start having the capacity then to flag those folks so that they then can follow through and be connected to the necessary services and supports. The last data point, again, I think is, at least from my experience, one that is rather tricky sometimes to track, but it is important to know the number of unique individuals who are coming through your system, because those of you who have worked in this field, you know that the same person can come through sometimes many times during the course of a calendar year, and it's important to be able to identify who your frequent flyers, if you want to call them that, are coming through, who they are, and definitely pulling those folks out for more individualized approaches. Next slide. Again, I'm going to just go through these 4 measures, probably not spend as much in-depth time on the next 3. I think that you're starting to see the process here. The next one is on reduce the length of time people with mental illnesses stay in jail. You will see that most of this data tends to concentrate around that pretrial stage of your process. Some of you have in place pretrial processes, screening, and policies, and many of you maybe haven't started down that path of work. But for those of you who are in a position to have screening in place for pretrial and to be able to sort for low, medium, and high risk, that is an essential data element to track. And then if you can, from there, separate out the length of stays for both your pretrial populations and your sentence populations. Over on the system capacity to develop, you'll start to see how once you're flagging is crucial, because then once you start to sort your data and you start to look at risk, your risk levels, and combining that with whether or not they flagged for potentially mental illness or substance abuse kinds of issues. And then also another conversation that probably your stakeholders will want to have is what was the underlying charges. Obviously, if it's a more serious charge, it may better explain for that longer jail stay, particularly at pretrial. But if it's not, then it does something to point to for your jurisdiction to consider as to how come that population is being held in jail with much longer stays than those that are not presenting with mental illness. Next slide, please. Okay, the next one is how to track for your increased connections to community-based services and support. So the data to track is divided between the percent of people that are connected to your court-based kinds of supervision and treatment programs. So if they are discharged pretrial to pretrial supervision, those then who are discharged without court-based supervision but are connected to your behavioral health care providers in your community. As I said earlier, it's really important to be able to not only ensure that that connection occurred, but that some of the language that's being used more is that there was a warm handoff, that there was some ways of tracking and following that the connection has occurred and that it is continued. Again, there's policies and processes that you can consider to implement that will help you to have programs and activity in place that will give you the data to track for this, as well as the kinds of things that your system is going to need to be able to track for. And again, it's matching that flag population with those matches. Next slide, please. And then for the final key measure, which is reducing the number of people returning to jail, the data to track for this one is going to be your percent of failures to appear and for new criminal activity for that pretrial population. And again, pulling out those who've been flagged for needing special attention for behavioral health disorders. Again, for the post-conviction population, you probably also want to look at, if possible, this is driving down deeper into your data, but do you track whether or not they are coming in for potential revocation? Is it based on a technical violation? Is it based on new criminal activity? Those kinds of data point you to potentially policy decisions. Do you have sanction and response grids in place to provide special attention to those who have mental health issues and perhaps maybe higher tolerance levels for some types of technical violations and those kinds of responses. And the last data point, number of prior offenses for people identified with mental illnesses booked into your jail. So that again is where you can pick up on that population that is cycling back through and tracking those lifetime jail admissions so that you can identify those folks. I'm sure those of you who are listening today working inside jail, you know who these folks are, but to have a more formalized way of identifying them and then again having a more individualized response as they obviously are occurring more often than you would like to see and need some sort of special kinds of case management. Next slide, please. So this is obviously very, very data heavy, data focused. So I also wanted to stress that it's also important to have this data in place because it's another way of also ensuring that your responses are appropriate. It's allowing you a way of tracking that you're maximizing your opportunities to connect people to the appropriate response, appropriate level of response, applying those risk and screening information, getting that information into the hands of decision makers in a timely fashion so that that first court appearance and the decisions can be made for pretrial connections to services, and then if they would proceed on into the system, that there would be responses within the jail and at discharge. Next slide, please. So to kind of wrap up my part of the webinar today, just wanted to end with that the benefits of having and focusing on these 4 key measures is a way of driving you to being able to identify your success in reducing your prevalence rates of the mentally ill in your jail. Seems to, I think, center around the fact that this is somewhat simple. It provides you with a very clear framework where you're clearly going to make decisions around implementation of programs and practices that are going to lead you towards being able to measure impact around those 4 key measures. It will allow you to evaluate if your investments, therefore, are paying off for you, if it's a good strategy, or if you're not having the kinds of results that you were hoping for. It helps you to more accurately quantify your gaps in policies and programs and where your funding needs. And perhaps, maybe most importantly, it gives you, I think, a good way of being able to communicate what it is you're doing and what you're accomplishing, and being able to have those informative conversations with your decision makers, especially when it comes time to looking at sustaining programs and also hoping to develop new kinds of responses. So that concludes my part of today's webinar, so I'm going to turn it back to Nastasia. Thank you.
Great. Thank you so much, Risa. That was really helpful. And for those of you who are wondering, we do have the slides will be coming to you, and all of this, the different charts and everything that Risa included in her presentation are going to be in the planning guides as well as those slides. So hopefully you weren't trying to ravenously write all of that down. We'll have that coming up. Thank you so much, Risa. So now I want to introduce Sarah Peterson to discuss what they're doing in Paddington County, South Dakota for Stepping Up. Ms. Peterson is currently serving as the director for the Paddington County Welfare Office and has held this position for the past 9 years. In this role, she's been leading efforts in Paddington County on their Stepping Up initiative and a number of other initiatives as well. Besides being a full-time mom, her previous work experience includes being a social worker at Prairie Lakes Hospital, Lutheran Social Services, and the U.S. Department of Energy. She's currently chair of the County Catastrophic Poor Relief Committee, is on the NACO Health Steering Committee, and the South Dakota Medicaid Advisory Committee as well. She's also past president of the South Dakota Association of Welfare Officials. Ms. Peterson, the floor is yours.
All right, thank you, Nastasia. Thank you. I'm just pleased to have this opportunity to talk to you about how to reduce the number of people with mental illness in jails. And this is just a rural perspective. Paddington County is under construction as we are in the beginning stages of this initiative. So the next slide is going to give us a perspective of what Paddington County, what rural means to us. So go ahead on the next slide. Paddington County, where are we? We're in northeastern South Dakota, and the county seat is Watertown. And then the next slide is going to talk about our demographics. Paddington County is a population of 27,227. We are the 6th largest of 66 counties in the state, and Watertown is the 5th largest city, and yes, we do consider ourselves a city and in this county, and our state has a population of less than 1 million. So we are really a rural county in a rural state. And then in the next slide, we're going to just cover this office. I am the department head for this office, the Paddington County Welfare Office. It's the lead office for this initiative, and you just take a look at our staff. I am it. So that's kind of what we have to work with. We do have collaboration with the other county offices. We have our commissioners who are also part-time state's attorney, sheriff, and detention center. And so that really it becomes imperative for the counties to focus on effectiveness, which is to do the right thing, and then efficiency is to do the thing right. And really, as rural counties, we just have the opportunity to embrace this challenge with creative thinking and unprecedented approaches. And so next, we are going to move on to our collaborators. So first, we have the advisories. It was important for us to include the expertise of the South Dakota state entities. Most of our federal money is received and handled at the state level, and they just have a lot of expert and advice. And then we also have a local state senator from our district and our South Dakota NAMI chapter as well. So next, we're going to move on to the collaborators who are the implementers. And these are the workers at the local level. We have the Human Service Agency, which is a non-governmental organization, and they are our locally federally qualified mental health clinic, and they provide a various services under one whole envelope. That's really fantastic for us. And then we have our various housing agencies that we look to. And then the state handles most of the economic assistance programs, so we look to them as well. And then on the other side, we have links that are needed, and we're having conversations and working with that to establish with a judge, city police, and then our state probation office. So then now we're going to move on to the catalyst to action, our increasing challenges, some of our driving forces. And as a state and locally, we just dealt with overcrowded prisons and jail. The state saw overcrowding prisons, and the county has seen a substantial increase of 45% to our average daily population since July. You know, our current jail is outdated and it's lacking. It's unable to meet the current jail standards. We have insufficient space for the courts. Our county is responsible to financially provide the court system needs, but the voters rejected a bond in 2014, and so they wanted to see more alternative solutions. And we're also seeing, as a state, more mental health crises. So then next, we're going to move on to what are our responses to these challenges. And in 2013, the state implemented Senate Bill 70, a Public Safety Improvement Act. And that state bill was to focus on reducing nonviolent inmates in our prisons. Because of this, the county anticipated seeing an increased number in our jails as a result, but we don't have the data to track that. And so then next, we're going to move on to the responses to the challenges too. Other initiatives as a result to these overcrowding included juvenile detention alternatives, the Senate Bill 73, the creation of drug and veteran courts, and then at the local level, the Paddington County Justice Advisory Committee. And just want to point this out, what this does, all this requires additional time of our county employees. So then, next, we're going to, that tells you where we've been, and next we're going to talk about where are we now. So on the next slide, we're going to cover accomplishments. The first step was for the county to take a look at what we have. The top 3 items are things that we had and had been implemented prior to the stepping up, and then the last 2 have been implemented since the signing up of the stepping up. So first, let's go to the next slide, and we'll start with our crisis intervention training. That started in 2014. Our lead is the county sheriff. The funding is provided by our State Division of Behavioral Health. The students include the law enforcement and correctional officers, and this really provided an understanding to the mental illness in our community. So this is a great launching effort to open up the potential for the Stepping Up initiative. So then next, we're going to move on to the Drug and Veterans Court. Now these are funded by the state of South Dakota. They're led by the circuit court system, and they utilize community partners for success. The drug court started in July of 2014, and they were provided additional funds from the state, but the Veterans Court, which started about the same time, used existing funds. But this could mean this can correlate to donated time by other agencies. And so then next we move on to our third half, which is our Human Service Agency. They're our non-governmental organization. They're federally qualified. And for us, the Human Service Agency was a key agency that we needed to collaborate with for success. They are a robust agency, and their mission is unique in that they have an advantage that the mental health and substance abuse services are under one roof. They also have what they call a CARE program, which is intense case management for individuals who suffer from severe mental illness. And they also have a halfway house for individuals with mental illness and addiction. And we, county has always provided funding. They receive other fundings to state and other grants as well. We've always valued their services. And so this was another opportunity to collaborate our efforts. So then next we go to the first step that we implemented since the start of the Stepping Up initiative. The county contracted with the Human Service Agency for a licensed professional counselor. You know, since we didn't have a lot of data and we knew that this need was now and we could implement it very quickly, how we did this is we took the national average of mental illness, and we knew this would be low for jail population. But we took that times the number of inmates and the amount of time a counselor would need per client. And that equated to a starting point of 20 hours per week. But we also know that the average daily cost of jail was $80. That doesn't count any medical or any, that's just your basic lowest rate cost. And so we knew that if the county could reduce the inmate population by 2 people, that the program would pay for itself. They also does provide crisis intervention, and for us that's reduced the number of involuntary commitments. And in our county, involuntary commitment requires the sheriff to transport 180 miles one way. So immediately we saw some cost savings by reducing those numbers. The mental health worker began in September 14th, and since that time has screened 78 clients. The purpose is to screen and stabilize the inmates and plan a rehabilitation return to the community. The project to start with is being funded by the County Welfare Office. And this is important to note because this was a 6 to 7 year endeavor. We first started looking how we could save money to be more effective. And money was saved by increasing case management and maximizing use of other programs and longer-term assistance programs instead of emergency services by other agencies. For us, that resulted in 32% savings the first year, followed by 60% the next 3 years, and fortunately the last 2 years have been about 80%. So this allowed us to move from a reactive to a proactive state with our funds that are available. And the Stepping Up initiative is a good fit because it incorporated overlapping agencies. It helps us to work together towards solutions for the individuals who are high risk, high need, and high cost to our community. So then next we'll move on to the Stepping Up Initiative Working Group. And these are the members of our working group that we meet, we plan, and our purpose is to plan and implement the program, and we meet monthly. The county commissioner passed the resolution with full support on June 23rd, 15, and they've just been a huge asset to us being able to move forward. So then next, where are we headed? Okay, so then on the next slide, we're going to talk about our long-range goals, is to reduce, rehabilitate, and use resources effectively. So let's start on the next slide with reduce. Reducing the number of people with mental illnesses in the jail. Our initial goal thought was reducing by 5%. What we wanted to do was to pick an attainable number to start. We wanted to start somewhere, and we wanted to be able to start quickly. Plus, we also knew we needed some time to work through the process as we get going. So this was a good starting number for us, or is a good starting number. So then next, we move on to rehabilitate inmates with mental illness. So right now, where are we at this process? We are at identifying a baseline for the population in our jail. And we are connecting to current resources to identify more of the haves that we have, and then also identify the needs and the gaps in the resources. So then we move on to using our human and financial resources effectively. One of the goals of this program, we wanted it to be able to provide it by utilizing current funding and not having mechanisms that we already had, current funds. And we wanted to take the cost savings and recycle those into the program and add additional services. And so for us, also the ideal future would include that the inmates transition smoothly into the community, to stabilize inmates in a planned release program, redirect before court and avoid incarceration, and then identify earlier. You know, how can we intercept before the jail system? And that just requires all of us to have to work together. So then next we talk about how do we reach our goals? How do we make it happen? So on the next, the steps to reach our goals, get your ducks in a row, sorry for the cliche, and then define, develop, identify, and proceed. So first, we're going to start on the next slide with get your ducks in a row. And for us, starting with training personnel, because we're a rural county, we really value the information that comes on the NACO webinar series, the conferences. But also I recognize that the webinars and conferences are a lot of information, and I kind of correlate it to they're like huge buffets. And I like to have everything at a buffet, but you have to pick and choose. So then we asked, you know, what items are we going to take, and what are we going to leave at the table? How would that look for a rural county, and how can we apply that? How can we reframe and shape that to fit? And so then our next step is to continue working on completing the links with our collaborators, and then identify our resources. And then finally, on the ducks in a row, is defining roles and responsibilities. And we are still working on this, but what we recognize is we have to actually phase people into the process because our workers are so stretched. So who can handle the load maybe for a little bit longer, and then phase it into that process as we alleviate other stresses. So then next, we're going to define how to measure success. Identify data gathered now and what it measures. What we really discovered is our accounting, we don't have a lot of data, and that we are working on to improve this. And then we're also looking to see how we can extract data that we have. And then determine what data will evaluate progress towards goals. We've began now using the correctional mental health screen, and we currently have the mental health worker doing the screening. And then thirdly, the collaborators have to agree on data. Right now we're working to gather data to get a baseline on the jail population. We're identifying those that have severe mental illness, and those with substance abuse, the average length of stay, have they received prior services, are they following up on services. So currently 50% screen have a severe mental illness, and about 25% have a mental illness, and we're still refining this process. So then next we just move into the developing the action plan and timeline. In our action plan, the task and time frames, this is a work in progress. We're still defining these tasks, and we're starting really, it's just with the data collection to get that baseline and setting realistic time frames that we can work with at a county level and rural. Collaborator agreement, and then coordination and oversight is by this office. I think the hardest part is we recognize where we want to be, and we tend to focus on that, so we always jump to that, and we just always have to take it back to be patient and work on the steps where we want to be. So then next we work to identify clients. Two categories commanded our attention: the low risk of offenses and low risk to reoffend, and the severely mentally ill. We knew for our county that we have more resources for those with severe mental illness. This target group could help us obtain faster results. It utilized current services, and we didn't have to create new programs, so it was effective and efficient. And then implement screening tools, the mental illness, substance abuse, risk to reoffend, and then adjust as necessary. And so then next, we're going to move to proceed with oversight. We meet regularly. We prepare reports on agreed upon data. We adjust as we needed. We've adjusted our screening system 3 times already. And then as the program is implemented, we assess adequacy of resources and the effectiveness of services to the clients. So then on the last slide, the review is how to get started. And first of all, it's establishing working relationships with the collaborators. It's important to change the can'ts to can. How can we? What can we do? Understanding the other agencies and entities, getting their advice, sharing information with each other, and then finding that common ground. What can you agree on? I find that anytime like you're working with where money is involved, you can have friction. So if you can set that aside. Clarify roles and responsibilities. And one of the things I always try to remember is we're all on the same team. We're all working towards the same goal, and that is to reduce those with the mental illness in jail and help them out. And then choosing the right data to measure progress, agree on an action plan. And this is always just being creative and how can it be done differently. And finally, the last thing, forgive me for the cliche, but it really is true. It's just doing it, just stepping out and doing it. You got to start. You crawl before you walk. And then when I think of a toddler, oftentimes they tumble or fall. But eventually, all toddlers do eventually walk. And before you know it, they're running. And before you know it, they're driving riding their bike and then driving a car. So we're just excited. We are definitely at the very beginning and working through this progress, but we're very excited to be where we're at. So thank you.
Great. Sarah, thank you so much for bringing that perspective, and Sarah's information is up here. Her contact information is up here if folks want to talk with Sarah. I think it's really helpful to have the perspective of a rural county and one of the smaller counties. We see it's very easy to see in the media and online some of the things that some of the bigger counties are doing, but we know that a lot of rural counties are doing some really great work, whether they're just getting started or they've already started to implement things like Paddington County, and they're going to be doing some really great things. So thank you so much for bringing that perspective. For our final speaker, I want to introduce Leon Evans to talk about the planning process in Bexar County, Texas. Mr. Evans serves as the Chief Executive Officer at the Center for Healthcare Services, which is the Bexar County Mental Health and Substance Abuse Authority in San Antonio, Texas. For over 40 years, Mr. Evans has worked tirelessly to improve the lives of people with mental illness. In his current role, he has developed an innovative and highly integrated system of care for people in the Bexar County and San Antonio communities who struggle with mental health disorders. He's served at numerous leadership roles at the local, state, and national level, including being on the board of directors for NAMI, Texas, participating on the National Association of Counties Justice and Public Safety Steering Committee, past president of the National Association of County Behavioral Health and Disability Directors, and he's also on NACO's Veterans and Military Task Force. He really spends a lot of his time now traveling around the country advocating and educating people on mental health in county jails, and so I'm going to turn this over to Mr. Evans now.
Thank you, and welcome everyone. So Sarah, I was so impressed with your county and your leadership. And like Nastasia just said, I do talk all over the United States and visit with counties and other folks about how they can also set up workable diversion programs that really help people reclaim their lives and improve the public safety net and save taxpayers' dollars. And what she hit on was the 3 or 4 things that I always say. It doesn't matter how big or how small you are, if you have the right leadership. In one of my slides here, and you know who's going to make us do it. Then you got to find a way to braid and integrate local, state, and federal dollars. You have to have data that you can use for continuous quality improvement. So yesterday we had a delegation from Oklahoma here and a person from Florida. Today we have the southern states of the United States today and tomorrow touring. And people are always very impressed with our programs, but the thing they're really impressed with is how'd you get everybody to work together. And before I had this job, I was the director of the Texas Department of Mental Health, Mental Retardation, Community Service Division. So I worked closely with the criminal justice system in Texas and became painfully aware of the criminalization of people with mental illness. And, I considered it a failure of the public mental health system that people couldn't get to treatment, and their alternative was to end up in county jails and prisons or homeless on our street or in our emergency rooms and in hospitals inappropriately. And so I actually tried to pay for some pilots here in Texas, and we brought consultants in and developed plans. And as Sarah showed on her slides, you really have to be able to have the mental health authorities, substance abuse, housing, all these other entities working together on this very sick and sometimes treatment-resistant population. But if you can ever get them to treatment, they do very, very well, and we have a lot of data to prove that up. And so I spent money on these pilots. Communities came together, they did planning, but when it got down to the actual implementation, people said, that's a great plan, but not with my money or my staff. So there's a natural resistance to work together for all kinds of reasons. If you think law enforcement community and the mental health community have a lot in common, we don't. We don't have the same mission, we don't have the same language, we don't have the same goals. But when you come to Bexar County, you'll find out that we have a great partnership with law enforcement. In fact, they understand us very well and we understand them very well. In fact, 95% of the 6,000 certified police officers have been trained in the 40-hour crisis intervention training. We have developed alternatives for jail and emergency rooms or putting people back on the street homeless. And so in 2002, our county was being cited for overcrowding and deplorable conditions by the Texas Jail Standards Commission. There's a federal judge to starting to look over our shoulder. Our county decided to buy bed space from other county jails. They brought in an expert that said you need to build another 1,000 beds on the county detention center right away. Well, that never happened because we started this training program. We developed this diversion program, an alternative to jail. We grew by 500,000 people last census. And I was with our county sheriff, who's a retired two-star general, and she told me just a couple weeks ago there were 800 empty beds in the county jail. The homeless count downtown San Antonio is down 80%, and we've been doing research with medical school here, and the number of inappropriate people with severe mental illness going to emergency rooms is down 50%. So how do we do that? Well, we did it, and we can go to the next slide. By developing this community collaboration or community partnerships. So we have lots of different organizations who come together on a monthly basis in 2 or 3 different forums. And we keep a lot of data on what's working and not working. So we have law enforcement, we have judges, we have families, we have consumers, we have hospitals, we have EMS, we have the homeless community. And everybody's showing up because they have a particular interest in seeing that this population gets treated in an appropriate way. And, it's been so successful that we've been able to keep enough data that we get a lot of local investment. And what would it have cost the county to add another 1,000 beds onto the county jail and operate it for the last 13 years? If you Google the cost of homelessness to taxpayers, you'll get all kinds of studies. The cheapest I saw was about $30,000 a year. So having the homeless count down 80 to 85%, and those people actually getting into treatment and recovering their lives and being productive citizens again make a huge difference. People with severe mental illness usually have co-occurring substance use disorders. The average person with severe mental illness in the United States dies 25 years sooner than you and I do, the general population. And the reason they're dying is because a lot of them smoke. It eases attention. A lot of them are self-medicating with alcohol and drugs because they haven't been diagnosed and they haven't gotten to treatment. They never get to primary care. have poor health habits, so they're not dying of their mental illnesses. They're dying of congestive heart failure and liver disease and all these horrid diseases. But they're million-dollar patients and they're unfunded, and it's a huge reason that the cost of health care is going up across the United States. In fact, the United States Medicaid directors went away a few years ago and looked at their populations and came back with this 15-50 rule. 15% of Medicaid recipients cost 50% of the Medicaid cost on average across the United States. That's the elderly at end of life and these people with severe mental illness and addiction problems. So we have these community collaboratives, and we keep a lot of data. In fact, Nastasia has the data just from our medical directors roundtable. Is about 30 pages and goes through a lot of things, so you're welcome to have that information and kind of look at what we track. We also try to, in our planning process, to kind of look at what will get the best return on investment, because like in Sarah's county, we're fairly poorly funded. So we've decided to take on the highest risk, the most difficult folks first, because they're in most of need. And generally speaking, people don't think that they'll do very well. But in reality, if these people are treated with dignity and respect and given some actual medical treatment, some good psychiatric treatment, and other kinds of motivational engagement kind of treatment, they do fairly well. And in fact, they do very well. And so because we've been able to do that, we do get a lot of local investment to be able to blend, braid, and integrate that federal, state, and local dollars. If you look at the next slide, like Sarah said, in her county, we're an overnight 15-year success. So we didn't have a lot of money. We had to decide what we were going to do first. We decided we'd start with training law enforcement officers, and once you get law enforcement officers trained to recognize the signs and symptoms of mental illness, then you have to have an alternative to jail, or they're still going to go to jail. So we started our first little crisis system, and we just built on it. We also found things in our community collaboration that we didn't have dollars to fund, like a sobering and a detox unit. Texas really doesn't fund alcohol and drug programs hardly at all. So it took us a long time, but we knew alcohol and drugs was a major problem in our community, and sooner or later we'd have to address it. So we were fortunate enough to find a way to build the sobering unit, detox unit, and get it funded. So we put it on a parking lot, and so we have a lot of those kinds of initiatives going on around logical planning, processing, collecting data, see what's working, not working, have a continuous quality improvement process. We open ourselves up to all of our critics in the community, and we share that information with them. And because of that, you know, people trust us, and we have a lot of community buy-in. So I just want to talk about the early intervention and diversion portion of this. So we have, on the adult side, we have over, just in one area, the Restoration Center, over 25,000 people a year are brought there for sobering or detox or the mental health crisis unit, mainly by law enforcement officers. Most of those people would have gone to jail or been put back on the street, homeless, or gone to an emergency room. The number of people that EMS and the ambulances are involved with is also way down. We have a second initiative right now that we're working with the county, the Sheriff's Department, and with the Council of Governments, where the county is paying for our mental health staff to go at bookend. And all law enforcement officers are asking 4 or 5 questions on everybody that's arrested before they're taken to the magistration, to the detention center. And it has to do with, do you have a mental illness? What kind of medications are you taking? Do you feel like hurting yourself or somebody else? And we also cross-match with the state mental health system. So if you've ever been treated in a state hospital in Texas or a community mental health center, you're in what's called the CARE system. Our staff are doing a mental health assessment. We're also doing a dangerousness assessment. So at that point, if it's evident you have a mental illness and you're probably not going to be in danger yourself or others, if you're released, we're getting with a judge and asking the judge to do a conditional release. would you release this person conditionally into treatment rather than put him in jail? So we have that first line diversion where people don't go to jail in the first place. Our second line is at right at bookend. Then we too have people that will get arrested because of the crime they committed require them to be arrested. But we have folks in jail who are endearing themselves to them. We're trying to set up that warm handoff that Sarah talked about when they get released so we can get them in treatment so they don't decompensate and be right back in jail. We also definitely believe in the therapeutic justice, so we help support with the therapeutic services, the therapies in the veterans courts, the mental health courts, the drug courts, the children's courts. And those programs all have phenomenal outcomes with lots of research that shows the return on investment are actually phenomenal. So I'll shut up, and I think we're going to have some questions.
Great, thank you so much, Leon. And as Leon mentioned in his presentation, they have these regularly scheduled check-in meetings with their advisory group, and these outcome reports that are 30 pages long that Leon has generously offered to let me share with you. So if anybody would like access to those, we'll make sure and post them on the Stepping Up Toolkit website, and you can also email me later or email Leon if you want a copy of those. You can see some of the things that they are measuring to help inform what they're doing going forward. So we have a few minutes left for questions. As a reminder, if you have any questions, please type them into the questions box on the right, and I'll ask them aloud. We have already gotten a few questions in. If we are unable to answer all of the questions during the session, we will send all of you the questions and answers via email. You'll receive an email with a link to the slides and the recording in a few days, and we'll have those up and running for you. So I just want to start with a question for, I think, all three of the speakers through their experience, and I think maybe we'll go in order. We'll start with Risa. It seems to be really challenging for folks to get some of the main players involved. What are some of the strategies that you used in your county to get judges, prosecutors, defense attorneys, sheriffs, these key players involved in your initiatives that you had going on in the county? How do you get them to really get engaged in this issue? Why don't we start with Risa?
Okay, well, that's a good question. So for me, coming from how the Johnson County Commission set up not only a criminal justice advisory council, but also what became my job as criminal justice coordinator, clearly it was coming from that level of the commissioners that they wanted this kind of work to happen. It just so played out that addressing the mentally ill in the justice system kind of rolled out to be one of our first big projects. So maybe it helped that the council was somewhat new and there was a lot of high energy. But even so, I think no matter what topic you're working on, it's always one player or a couple that drift in, drift out, and don't get as involved. I mean, I always personally did a lot of one-on-one conversations with those folks and let them know how important they were to the process. Also, sometimes some peer pressure helps. I think sometimes for them, if you're doing agendas and minutes and they read those minutes and they see, wow, this is not a do-nothing group, they're making decisions and so forth, I think that plays into, making sure that you get that representation at the table.
Great. Thank you. Yeah, absolutely. Sarah, did you have anything you wanted to add to that about your experience in Paddington County?
I think a lot of what I'd have to say would repeat what Risa had to say. And we're still working on this, and a lot of conversations were one-on-one, addressing the concerns. And a lot of times as you visit with people and you ask them what their concerns are, you can really address that. But it goes back to, well, what can we do? I think it's an overwhelming thought sometimes. I said, if money wasn't an issue, how would you like to see this work, or where would you need help? And then kind of taking it back, sometimes you've got to resolve maybe a concern or an issue prior to that working. Like our staff, we had our sheriff and detention, they're just stressed. You know, what could we do to help? You know, so I did a lot to help serve them, hopefully, that they could give some time and knowing that you would carry a lot of that load. But definitely, you know, addressing their concerns, identifying the why nots and what you would like to see. And I think a lot of times as you have those conversations, everybody would like to see an initiative like this started because it is a good thing and it's right. You just need someone to help you walk through it, how you can do it, how it would be possible.
Mm-hmm. Absolutely. Thank you. And Leon, you travel all over the country, so you probably see this a lot. Anything else that you wanted to add to what these two said?
Yeah, so I have a little different take on it. You know, remember, I funded 2 big pilots in Texas that were utter failures. And when I got started being tired of being a state bureaucrat and left the state and came here, I wanted to work on this problem. But I knew if I tried to call the leadership of the community together, nobody would have shown up. And if they had to be somebody that could say no and not yes. So I went to talk to our county judge, who's still our county judge, Nelson Wolf, and explained the problem. And I said, Judge, we need a champion. We need somebody that will call us together and make us work together and, come together to address this problem. And of course, he's very bright and he got it right away. So he not only wrote the letter to the community leadership, but he got the mayor to co-sign it. And he showed up at the first little task force and charged us all with looking at this jail diversion and this problem around criminalizing the mentally ill. We were smart enough to put a judge in charge of the task force, so we met in her office monthly, and Gilbert Gonzalez, who is now the county mental health director, and they deliver no mental health services, but they do planning and statistics. We hired Gilbert to help do the minutes, so that Sarah said, our minutes were distributed widely. So if you're there representing one of the county commissioners or the sheriff or the police chief, and you had an assignment or you weren't showing up to the meetings, everybody knew about it. So there's a lot of pressure because of the leadership there expected us to work on this, for people to show up and actually, put some effort into it. And because of that, I think that gives us opportunity to get to know each other, trust each other, learn about each other's missions and goals and language. And out of that came this phenomenal community collaboration that still exists today. And nobody has to make us come together any longer. People show up because they know their participation makes a big difference because we've got the data to prove it.
Mm-hmm. Absolutely. Great. Thank you all. Unfortunately, we've got to sort of wrap this up, so that's going to be the last question that we have for today. We've gotten a number of different questions from folks that are directed at different speakers, and I'll make sure and forward on your questions to them so they can answer that. Before I go, I do want to talk about the National Stepping Up Initiative, or the Stepping Up Summit. The National Stepping Up Summit, for those of you who are signed up for the Stepping Up listserv, and by doing that, again, you go to the Stepping Up website, stepuptogether.org, and click on Take Action Now to be added to the listserv. Today, we opened up the application process for a National Stepping Up Summit. The National Stepping Up Summit is going to be happening April 17th through the 19th, 2016 in Washington, D.C. The National Summit really provides an opportunity for county teams to come together to create or advance the specificity and the impact of their county plans to reduce the number of people with mental illnesses in jails. We're going to offer breakout learning sessions. We're going to feature national and local subject matter experts like folks who are on these webinars. We're going to have informative plenaries, meaningful networking and peer learning opportunities, and designated time for team planning sessions to really incorporate all of this information into their county plans. The hope is that participants will return to their communities with the resources and materials to aid in their development, their implementation, their monitoring, and sort of reflect some of the lessons learned from that summit. The National Summit is open to all counties and regions in the U.S., but space is limited. Only 50 counties will be selected to attend. Counties are going to be asked to form teams of up to 5 people to attend the summit, and at least one member of each team must be a county commissioner or supervisor. We will be giving priority consideration to counties that have passed resolutions or proclamations in support of Stepping Up or similar initiatives. So if you've already passed one, please make sure and submit that to me. My email will be on the next slide, so that we can make sure that that's included in there. Stepping Up is going to provide travel stipends. Thank you to the American Psychiatric Association for that funding for up to 5 team members from each selected county to participate. Stipends include hotel, round-trip airfare, ground transportation, and meals at the conference. So you can fill out the application online. The website is right up on their slide, stepuptogether.org/toolkit. Just click on the link and you'll get much more information on what the summit is and some of the eligibility and some of the ideas there. And then you can also fill out the application online on that website. Applications are going to be accepted until December 18th. 2015, and then we'll notify the selected counties at the end of January. So that's it on the Stepping Up Summit. I want to do a couple of real quick poll questions before we go. If we could go ahead and launch poll number 4, and we'll just rush through these. Wonderful. Thank you, everyone. Why don't we close that one and launch the next poll? Great. And then one more poll. Let's close this one and start the next one. All right, thank you all so much. Let's go ahead and close that poll. Just a reminder, here's my contact information. If you have any questions about anything that happened on the webinar, we'll be sending out information, the recordings and the slides and all of the information from this webinar. Make sure and sign up on the Take Action Now so you can get notifications when we have new webinars. And I just want to thank our 3 speakers, Risa Hanneberg, Sarah Peterson, and Leon Evans, for taking their time to be with us today and for your great presentations. Thank you to all of you for your participation and for your questions during the webinar. And we hope to have you on future Stepping Up webinars. And please don't forget to fill out those surveys right after the end of the webinar. Thank you very much, and everybody have a great day.